As we age, our bodies undergo natural changes that can sometimes mask serious health issues. For seniors over 65, recognizing when something is wrong and seeking medical attention promptly can be the difference between a treatable condition and a life-threatening emergency. While occasional aches or fatigue may be part of aging, certain symptoms are red flags that demand immediate attention. This article explores 5 critical symptoms that seniors over 65 should never overlook, why they matter, and what steps to take to protect health and well-being. 1. Sudden or severe chest pain. Chest pain is one of the most alarming symptoms for anyone, but it's especially critical for seniors over 65. While it's commonly associated with heart attacks, chest pain can also signal other serious conditions like angina, aortic dissection, or even a pulmonary embolism. For seniors, the risk of cardiovascular disease increases with age, making chest pain a symptom that should never be dismissed as just heartburn. Why it's serious. According to the American Heart Association, heart disease is the leading cause of death for adults over 65. A heart attack occurs when blood flow to the heart is blocked, causing damage to the heart muscle. Symptoms may not always be dramatic. Seniors, especially women, may experience atypical symptoms like discomfort rather than sharp pain, nausea, or shortness of breath. Aortic dissection, a tear in the aorta's inner layer, is another life-threatening condition more common in older adults, particularly those with high blood pressure. What to do? If chest pain is sudden, severe, or accompanied by symptoms like sweating, dizziness, or pain radiating to the arm, jaw, or back, call emergency services immediately. Even if the pain is mild but persistent, consult a doctor within hours. Early intervention can prevent permanent heart damage or other complications. Prevention tips. Seniors should manage risk factors like high blood pressure, cholesterol, and diabetes through regular checkups, a heart-healthy diet, and prescribed medications. Quitting smoking and staying active with doctor-approved exercise also reduce cardiovascular risks. 2. Unexplained weight loss. Losing weight without trying might sound like a dream for some, but for seniors over 65, it's often a warning sign of underlying health issues. Unintentional weight loss, defined as losing 5% or more of body weight over 6 to 12 months, can indicate conditions ranging from cancer to thyroid disorders, depression, or gastrointestinal problems. Why it's serious. Unexplained weight loss is a red flag for serious conditions like cancer, particularly lung, pancreatic, or colorectal cancer, which are more prevalent in older adults. It can also signal hyperthyroidism, where an overactive thyroid speeds up metabolism, or malabsorption disorders like celiac disease or Crohn's disease. Additionally, weight loss may be linked to mental health issues, such as depression or dementia, which can reduce appetite or lead to forgotten meals. What to do. If you or a loved one notices unintentional weight loss, schedule a doctor's visit promptly. Keep a record of how much weight was lost and over what period, along with any other symptoms like fatigue, nausea, or changes in bowel habits. The doctor may order blood tests, imaging, or a referral to a specialist to pinpoint the cause. Prevention tips. Regular medical checkups can catch early signs of conditions that cause weight loss. Seniors should maintain a balanced diet rich in protein, healthy fats, and complex carbohydrates to support muscle mass and energy needs. If appetite is low, consult a dietitian for strategies to boost nutrition, such as smaller, nutrient-dense meals. 3. Severe or persistent shortness of breath. Difficulty breathing or feeling like you can't catch your breath is a symptom that should never be ignored, especially for seniors. Shortness of breath can stem from heart or lung conditions, both of which become more common with age. It may occur suddenly, as in a heart attack or pulmonary embolism, or gradually, as in chronic obstructive pulmonary disease (COPD) or heart failure. Why it's serious. The National Heart, Lung, and Blood Institute notes that heart failure affects over 6 million Americans, with seniors being the most vulnerable group. In heart failure, the heart can't pump blood effectively, leading to fluid buildup in the lungs and shortness of breath. Similarly, COPD, often caused by long-term smoking, restricts airflow and is a leading cause of disability in older adults. A sudden onset of breathlessness could indicate a blood clot in the lungs, pulmonary embolism, which requires immediate treatment. What to do? If shortness of breath is sudden and severe, call 911. If it's persistent or worsens over days or weeks, see a doctor as soon as possible. Be prepared to describe when the symptoms started, whether it occurs at rest or during activity, and any associated symptoms like swelling in the legs or a cough. Prevention tips. Avoid smoking and exposure to secondhand smoke to protect lung health. Regular exercise, such as walking or Tai Chi, can improve cardiovascular and respiratory function, but always consult a doctor before starting a new routine. Vaccinations for flu and pneumonia are also critical for seniors to prevent respiratory infections that can exacerbate breathing issues. 4. Sudden confusion or changes in mental status. A sudden change in mental clarity, such as confusion, disorientation, or difficulty speaking, can be a sign of a medical emergency in seniors. These symptoms may point to a stroke, severe infection, dehydration, or even medication side effects, all of which require urgent attention. Why it's serious. Stroke is a leading cause of disability and death in seniors, with nearly 800,000 cases annually in the U.S. per the CDC. A stroke occurs when blood flow to the brain is interrupted, causing brain cells to die. Symptoms like sudden confusion, trouble speaking, or weakness on one side of the body are hallmarks of a stroke. Other causes of mental status changes include urinary tract infections, UTIs, which can cause delirium in older adults, or electrolyte imbalances from dehydration or kidney issues. What to do? Use the FAST acronym to spot stroke symptoms. Face drooping, arm weakness, speech difficulty, time to call 911. Even if symptoms resolve quickly, a possible transient ischemic attack or mini-stroke, seek medical care immediately. For non-stroke-related confusion, see a doctor within 24 hours to rule out infections or medication issues. Prevention tips. Control blood pressure and cholesterol to lower stroke risk. Stay hydrated, especially in hot weather, and monitor medications carefully, as some can cause confusion as a side effect. Regular cognitive activities like puzzles or reading may also support brain health, though they don't directly prevent strokes. 5. Severe or persistent abdominal pain. Abdominal pain that is severe, sudden, or lasts more than a day or two is a serious symptom for seniors. It could indicate anything from a gastrointestinal issue like appendicitis or a perforated ulcer to a vascular problem like an abdominal aortic aneurysm, AAA. Why it's serious. An abdominal aortic aneurysm, a bulge in the aorta, is particularly dangerous for seniors, especially men over 65 with a history of smoking or high blood pressure. If it ruptures, it's often fatal without emergency surgery. Other causes of abdominal pain include gallstones, kidney stones, or bowel obstructions, all of which are more common in older adults. In women, severe pelvic pain could also suggest ovarian issues. What to do? Seek emergency care for sudden, intense abdominal pain, especially if accompanied by fever, vomiting, or blood in the stool. For persistent pain, consult a doctor within 24-48 hours. Be ready to describe the pain's location, intensity, and any other symptoms, as this helps narrow down the cause. Prevention tips. A diet high in fiber and low in processed foods can prevent gastrointestinal issues like diverticulitis. Regular screenings, such as ultrasounds for AAA in high-risk seniors, can catch problems early. Stay hydrated and avoid heavy lifting if you have a known hernia or other abdominal condition. Why seniors are at higher risk. Seniors over 65 are more vulnerable to serious health conditions due to age-related changes in the body. The immune system weakens, making infections harder to fight. Chronic conditions like diabetes, hypertension, or arthritis can mask or complicate symptoms. Additionally, seniors may downplay symptoms, attributing them to old age, or hesitate to seek help due to mobility issues or fear of medical costs. Caregivers and family members play a crucial role in recognizing these warning signs and advocating for timely care. General steps for seniors and caregivers: keep a symptom journal. Note when symptoms start, their severity, and any triggers. This helps doctors make accurate diagnoses. Know your medical history. Share details about chronic conditions, medications, and past surgeries with healthcare providers. Have emergency contacts ready. Program emergency numbers into phones and keep a list of medications handy. Thank you.